Hi there, Damian David with Cornerstone Advisors. Welcome back to my episode 3 of Week in Review. The week of April 28th, 2020, and our fight with coronavirus and COVID-19 continues. So I know we've been at this a long time, and I know you're probably getting tired. A lot of energy, a lot of efforts. Really appreciate what you're doing for your communities. Please continue to be safe, and please continue to put forth the effort that you do. Again, we appreciate you. Next 10, 15 minutes. Actually, this time I did limit it to 15 minutes. First two of these, 30 minutes. What can you do? Sorry. But the next 15 minutes is devoted to telling you some of the highlights that happened over the past week. So some of the more loud news headlines that I've seen that are COVID-19 related. I had a couple minutes to catch up with our very own Kate Corbett, talking about health information exchange, interoperability, it's how it's impacting, how it's affected by COVID-19 experience, helpful tips, ways that people can get involved or find out more information on that. And then lastly, just a few moments, a couple of minutes of your time, some positive things that have happened in the past week, hopefully to lift your spirits, revitalize, and give you some better energy to complete and carry out your week here with all the important work that you're doing. So without further ado, headline number 1, CDC adds 6 new symptoms to the COVID-19 symptoms list. Chills, repeated shaking with chills, muscle pain, headache, sore throat, and then new loss of taste or smell. So that's 6 plus the original 3. Those are 9 of the different symptoms I had the first week of March. So I tested negative. So that brings us to the next headline, the update on the antibody tests. Antibody test is definitely something that I'll be getting and receiving at the prompt of my primary care based on what happened to me about a month and a half ago. Just to kind of rule out and see if I did actually have COVID-19, and then also so we can start to study what that means. Is there, do you become immune to it or not? Nobody really knows. There's no evidence one way or the other at this point. To be honest with you, there's no real update on the antibodies test this week. We've been waiting. They're about 2 weeks overdue. There are reports of tests being available and people doing testing, but there aren't any really good reports of results or effectiveness of the test at this point. So we continue to wait. I hope I have better news for you next week. All right, next headline. So we've been keeping an eye on the Smithfield Meat Packing Company. If you remember, it closed first at Sioux Falls plant because 297 different employees tested positive for COVID-19. Then last week, I reported that they closed their Tar Heel, North Carolina plant due to a high volume of employees tested positive. This week, the news on Smithfield continues. A third plant, one in Missouri, is being sued by its employees for not appropriately managing this outbreak effectively. So at this point, that's all the detail that I have. I'll keep an eye on that as situations progress and the investigations go on to see if they've started to get control over COVID-19 coronavirus, and then we'll see the aftermath of it, hopefully, as they get control of it, turn the corner. Not the only ones in the meat packing industry experiencing difficulties due to the pandemic. Cargill has been experiencing some difficulties and some operation shutdowns, some plant shutdowns, etc., as well as Tyson. Tyson had 4 employees actually pass away earlier this month due to COVID-19 complications. Even John Tyson himself had 3 sound bites that were kind of alarming. So the first one being the food supply chain is breaking. The second one being millions of animals will be depopulated due to the shutdowns. And then thirdly, millions of pounds of meat will disappear. So we might brace ourselves for the reality of not having a lot of meat available to us in our food chain, either at stores or wherever we're used to getting it for consumption. So I'll keep my eye on that. A little bit alarming, but okay. Tennessee reopens its restaurants for dining in on April 27th. So that's today as I record this, or yesterday. You'll be viewing this on Tuesday when I post it. It's only been a day since they recorded their highest new single day jump in new COVID-19 cases, though. So I don't know how this is going to play out. So we'll see. I'm not a fan of reopening things, but again, not trying to be political here. We'll see how this plays out, and I hope it works out okay. So Johns Hopkins University of Medicine, they just recently posted, and they're offering a free 3-module course on, the title is Understanding the COVID-19 Pandemic. It's a fabulous content. I started looking into it. I haven't completed it yet, but I will. A former colleague of mine and I, we trade information back and forth. I don't know if we're being detectives or if we're trying to get a better understanding, or we're just overly interested in coronavirus COVID-19. But I can tell you, of the content that we've reviewed, this is very quality content available at Johns Hopkins University. It's worth checking out. Scroll down, look in the description. I put a link into where you can find it. If you're interested, I suggest when you have time to check it out. To that, also below are links to a lot of the different things that I'm talking about in this week in review, as well as some links to some people that have answers if you're looking how you can seek funding to tap into some of the EHR or telehealth operations, etc. Scroll down. It could be helpful to you, at least maybe trying to get some money back after this has all been resolved and we recover from the pandemic. Also, there's links to my LinkedIn page. Please link in with me, and then also Kate Corbett, who I'll be talking with in a few moments here. And then the last headline before I get into the stats of at the world and at the country level for coronavirus COVID-19 is New York hospitals are giving famotidine a try in the fight against COVID-19. So famotidine is the active ingredient in heartburn. It's Pepcid. So the heartburn drug, Pepcid. They think that it might have a positive effect and be helpful in the fight against COVID-19. So they're doing a clinical trial. They currently have 187 patients enrolled in that, and they're hoping to expand that up to about 1,200 patients so they get a decent clinical trial on its effectiveness. So that's interesting to me. Let's see what happens. Let's see if that's a factor. Let's see if that's another tool or weapon we can use in this battle against COVID-19. That'd be great. Okay, let's get to the stats. On a weekly basis, I've been sharing with you the statistics. Again, not to be doom and gloom, but I think it's important that we shed some light on this. So I'm going to get to my notes here so I can compare to what happened last week, because I want to understand it better this week to last week. This week, at a worldwide level, we're up to 3 million confirmed cases of COVID-19, okay? Last week, we were just at 2.4 million, so that's quite a substantial jump. 879,000 people have recovered from COVID-19, whereas last week we were at 639,239. So that's good news. Almost 250,000 more recoveries this week. That's fantastic news. On the deaths, we have 208,000 deaths globally for COVID-19. Last week we were at 167,369. I don't know if it's tapering off or slowing. In the U.S., so inside the United States, we have 999,000 confirmed cases, whereas last week we were at 778,027. Quite a substantial jump there too. Of that, 110,000 have recovered as of this week. That's up from 71,280 from last week. But when we look at the deaths, we have 56,035 deaths in the U.S. due to COVID-19 complications. Last week, we're at 41,376. The week before that, 23,068. So it looks like it's slowed down a little bit this week as far as deaths, which we got to be thankful for that. Okay. So that's the headlines for this week. Let's transition. I mentioned spend some time with Kate Corbett on the phones. Without further ado, let's toggle over to that conversation. Hey, Kate, how you doing? Everyone, this is Kate Corbett. She's joined me on this week in review here. Kate is our Associate Vice President over the Epic practice. Kate, you got a couple minutes?
I do, absolutely, Damian. I'm excited to chat.
Where are you calling in from?
I'm currently in northern New Jersey.
Like Paramus, or when you say northern New Jersey, where are you at?
A little town called Madison, so not far from Paramus. We're about 25 miles from Manhattan.
Oh, wow. And how are you holding on?
Well, luckily I live in a great small community. Everybody follows the social distancing rules and is super supportive of their friends and neighbors. So, we get by pretty well.
Well, good. Well, hopefully you'll continue to stay safe, and everybody, all your family, friends, etc., are safe too. So, all right. So, we talk a lot on these Zoom chats throughout the company, and the latest and greatest that I heard that you were working on, I've been kind of keeping track of it a little bit. That's why I'm excited to have you on the call here, is that you're working on some integration work to support HIEs, and then also information sharing across different communities, etc. Tell me more about that.
Yeah, Damian. So we've had a really cool opportunity to branch out from some of the work where we focus on a single provider organization's EHR and work with a collaborative organization. Their members are over 40 public hospitals, many of them rural. They've been trying to fulfill different goals over the last 3 to 5 years around care coordination, population health. They want to look at value-based care. So we started helping them at the end of 2019 really look at what they are doing for clinical data sharing, what the options are within the technological ecosystem for sharing clinical data, whether it's among that group of healthcare providers or with other relevant parties. And, we've learned, some things that really put them in line with national trends. About 2/3 of healthcare providers, both in the group that we worked with and nationally, are aligned with either a state-based health information exchange or a national health information organization to help them move data among themselves. But there are unfortunately gaps there. And for organizations that maybe are smaller or have resource constraints, their ability to take on participation in a health information exchange can be pretty challenging. So we're hoping to support them in becoming a partner so that they can fulfill some more of their goals.
That's great. So, even though it sounds like this got started a while ago and there were some goals and some vision around this, how does this lend itself to the hot topic of the day, COVID-19, what we're going through for the pandemic, how we're trying to care for our immediate communities, but also, getting access to and expanding outward to make sure that we can truly, A, understand this, and then B, get a grip on it and move forward?
Well, the very first immediate need for a healthcare provider during COVID is having relevant clinical information on a patient who shows up who is acutely ill. So a patient arrives at an emergency department, is having COVID-related symptoms. The care team there in the emergency department is going to want to know whether they've cared for that patient previously or not. What's that patient's medical history? Are they in a high-risk group? Do they have a comorbidity that if the testing comes back positive, they need to pay special attention to that patient? The second thing that's been really difficult for both healthcare providers and public health agencies during COVID-19 is being able to track cases of COVID-19 infection and to aggregate that data across all the health systems in a particular geography. So many state public health agencies have surveillance systems that historically do not integrate with the electronic health record system of a provider organization. But what many have done is try to connect with their statewide HIEs or even the national health information organizations to get as much data out of those as possible to be able to research presumptive cases of COVID-19 and also to try and plan for bed capacity. So it helps to reduce some of the data blind spots that they're relying on provider organizations filling manually. It's not 100% there, but these health information organizations and health information exchanges are really good sources of data for a public health agency, that the data is already going from about 2/3 of provider organizations into those sources of data.
I'm interested to see how this pans out and how much impact that this experience, as far as influence on helping it along, expediting and speeding up the process of getting more people focused on this type of work. So.
Well, there's some state and federal funding, both for the CDC and the Office of National Coordinator for Health Information Technology, because I think it's been recognized that this is a gap that needs to be filled.
Well, thanks for joining me for the past couple minutes. You ready for one last question here?
I think I can take one more, Damian.
All right. If you could spend an hour with anyone in the world or from history, you got 30 seconds for this. Ready? Who would it be and what would you do?
I think that I would have tea with Queen Elizabeth II. She has been through a century of very fascinating history. Her role has evolved and culture has evolved so much in her lifetime. I think in an hour I could learn a ton. That's
a good one. I like that one. I never even thought about that. Well, hey, thanks again, Kate. Take care. Hopefully you'll stay safe and continue to be prosperous.
So that's a great conversation. I always like talking to Kate. I can never talk enough about health information exchange and interoperability, or the value of it, especially in times like this, being able to grab information and data that you've so heavily invested in, not just from your own system, from throughout your health system, neighboring health systems, regions, states across the country. Really important to be able to gain that intelligence. Will help you in the challenge of overcoming these types of situations. To speak to that, our friends over at ActiWare, for you Meditech users, they have a tool that they built on top of Meditech Data Repository. It's a COVID-19 dashboard. I put the link below. It's worth taking a look at. Very powerful tool. Could probably provide you some value. Take a look at the link. I think it might be low cost or free to use it or to install it yourselves. Obviously, if you want to have the experts plug it in, ActiWare is available. It's pretty nominal fees, I think. Totally worth it. Take a look at it. Check it out. Very powerful tool again. Hey, thanks for joining me for yet another week in review. I hope to see you next week. I'm going to leave you on some beautiful visions, just pictures from throughout the world, just to remind you that it's all worth it. You know, it's hard to see how beautiful the world is in times like these, especially when you're tired. So I'm going to leave you with some pretty pictures, just some of the amazing wonders of the world, if you will, over the top into the Mystic, which was my last Friday's coffee lunch break. Is it lunch break coffee house? So I have a record for you. All right. Hey, take care. Have a good week. Stay safe.
We were born before the wind. I so younger than the sun. Hey, the bonnie boat was won as we sank into the mystic. Hark now, hear the sailors cry. Smell the sea and feel the sky. Let your soul and spirit fly, sail into the mystic. Yeah, when the foghorn rolls, you know I will be coming home. Yeah, when the foghorn whistle blows, I wanna hear it. I don't have to feel it and die. Follow up your gypsy soul. You slide way back in the days of the old, and magnificently we will flow. carry on. And magnificently we will float into the mystic.